familiar with tonsillectomy, right? To reiterate it, it is nothing but a surgical removal of the tonsils. They are the two oval-shaped pads of tissue at the back of the throat, one tonsil on each side. A tonsillectomy was once a common procedure conducted to treat infection and inflammation of the tonsils. However, it comes with its own risk factors. Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan, and today I am going to discuss about the rising concern on post-operative mortality following tonsillectomy in children. The increasing rates of post-operative death in children undergoing tonsillectomy is quite uncertain. The mortality rates are not separately reported for children per se, at an increased risk of complications, including young children and those with sleep-disordered breathing or even complex chronic conditions. A recent retrospective cohort study that was published in the JAMA network, it included close to 5 lakh participants who were younger than 21 years of age, for whom discharge records were easily available to link either outpatient or inpatient tonsillectomy that was carried out with at least 90 days of follow-up period. The post-operative death was characterized as death within 30 days or during a surgical stay which is longer than the 30-day window period. Now, out of the total 5 lakh children, 10.1% tonsillectomies were performed in young children, 28.9% in those with sleep-disordered breathing, and 2.8% in those with complex chronic conditions. It was therefore found that there were 36 post-operative deaths which occurred in 4.5 days after the surgical admission, and most of which occurred after surgical discharge. Additionally, neither those younger than 3 years nor the sleep-disordered breathing group was significantly associated with mortality, but children with complex chronic conditions had a higher mortality rate. Children with complex chronic conditions, they accounted for 2.8% of the tonsillectomies but 44% of post-operative death. Most deaths associated with complex chronic conditions occurred in children with neurological or neuromuscular or congenital disorders. Therefore, the researchers concluded that among children who are undergoing tonsillectomy, the rate of post-operative death was 7 per 1 lakh operations overall and 117 per 1 lakh operations among children with complex chronic conditions. Hence, these findings definitely will help practitioners in decision making before performing pediatric tonsillectomy. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.